COVID has created tremendous challenges across the entire healthcare system. Fewer patients with heart attack, stroke, and other serious illnesses are seeking care. Hospitals have had to limit elective treatment and outpatient visits, and COVID has created a nearly unprecedented crisis in mental health. Yet, given all the limitations in care, COVID has sparked tremendous innovation in the Department of Psychiatry at Massachusetts General Hospital. Foremost among them has been the vast expansion of telepsychiatry services under the leadership of Dr. Maurizio Fava. First, Dr. Fava, you've given a lot of thought to the factors contributing to depression during the pandemic. What are the most important to be aware of?
You can imagine you have the trauma from widespread disease, the grief over the losses of lives of people that we love and we care for, the fear of getting sick, the anxiety, the unprecedented physical distancing. We've never had to be so far apart from others as we have now. Financial concerns, unemployment, housing insecurity, people not being able to pay for their rent, people not being able to pay for their food, the loss of community, the gatherings, whether religious or not, that allowed us to get a sense of community have been affected by COVID-19. And finally, reduced access to caregivers. People have been afraid to see their doctors. All these things are clear contributors to why we see this marked increase in anxiety and depression secondary to COVID-19.
It's this problem of reduced access to care which has led to the transformation of telepsychiatry. Dr. Maurizio Fava is Psychiatrist-in-Chief, Department of Psychiatry at Massachusetts General Hospital and a professor at Harvard Medical School. He is a worldwide leader in the field of depression. Dr. Fava has authored or co-authored more than 800 original scientific articles, and his articles have been cited more than 80,000 times in the literature. So, Dr. Fava, how much has telepsychiatry increased over just a year ago?
It's been a tremendous change. A year ago, only 5% of our patients were seen through telepsychiatry. And now it's over 95% of our visits are virtual visits. And we're seeing more patients now than we were seeing, globally, if you wish, than a year ago. So our outpatient services are even greater than last year at the same time, thanks to telepsychiatry.
Telepsychiatry is as simple as a Zoom call from the privacy of your home and is easily scheduled and highly convenient. In fact, Dr. Fava and I conducted this interview using Zoom. You'll be able to see your psychiatrist in an informal setting, and he or she will be able to see you and easily converse. Your psychiatrist can also show you key resources, and you can share as well. Dr. Fava, there is a long tradition of psychiatrists seeing patients in their offices, in person. How do patients like telepsychiatry from your observations so far?
And I have to say, many of the patients that I see tell me that they actually like having their visit through Zoom or virtual visit, because they don't have to drive, they don't have to park, they don't have to it's the comfort of getting a visit from your home.
What are the key advantages of telepsychiatry?
I think it's time saving for the patient, because if you think about it, if you live in the greater Boston area, it may take you an hour each way to get to the hospital. You need to park, you need to pay for transportation. We, for example, see that the no-show rate, that is people not showing up for their appointments, is markedly lower now than we do everything virtual. In some ways, you can tell that the user friendliness of the approach is gaining a lot of traction. In psychiatry, we don't need to do physical examinations, or we don't have to. So the delivery of care is perfectly suited to be virtual.
Is telepsychiatry less stressful?
It might be less stressful because you don't have to drive in Massachusetts, which may be a good thing. But I actually enjoy driving, but I think that you're diminishing certain things that can be stressful for some people. You may also reduce, in some ways, some people may be uncomfortable being in a waiting area of a psychiatric clinic, but I think that these days, thank God, the stigma is markedly diminished, and I think people realize that it's like any other doctor's office. But I think that it may be the reduced stress may be more related to the transportation.
How effective is telepsychiatry compared to in-person psychotherapy?
The advantage is that you can reach out to patients wherever they are. And, so far, the data suggests that it can be as effective as in-person visits. And the consumers, the patients, seem to like virtual visits. The train has left the station with respect to telemedicine in psychiatry.
Does telepsychiatry make it less difficult to get in front of a psychiatrist quickly and easily?
Telemedicine would allow you to, for example, if you have a cancellation, to fill that cancellation very easily. Because if you find out that a patient cannot see you in 30 minutes from now, you may be able to do that virtually. And so I think that virtual visits will markedly improve access to mental health care.
Telehealth has opened up across the country for a vast array of services thanks to changes in government regulations due to COVID at a scale most never imagined. And psychiatrists can practice across state lines. Can people in all 50 states access MGH psychiatry now?
Well, right now, yes. Right now, yes. And we hope that this openness to allow us to provide services and increase access to people out of state will continue.
Will telepsychiatry become the standard for mental health care over in-person visits?
But we had never really adopted virtual visits as a kind of standard of care. And I think that with COVID-19, we really now have to challenge that view that in-person visits should be the standard. I think that telemedicine may become the standard for mental health.
Thank you so much, Dr. Fava, for tremendous innovation and the superb care your department delivers to so many patients in distress. For more information, clinicians within the Department of Psychiatry have curated a guide to mental health resources that includes tips, blog posts, videos, apps, and other resources for anyone looking for help coping. You can also reach out directly to the department and arrange a telepsychiatry visit.